Across the United States, the conversation surrounding marijuana is undergoing a significant transformation. What was once a substance largely confined to the shadows is now stepping into the mainstream, with its legal status shifting in many parts of the country. As of early 2024, a large number of states have legalized cannabis for either medical or recreational purposes, reflecting a broader societal acceptance and changing public opinion. This wave of legalization has made marijuana more accessible than ever before, leading to a noticeable increase in its use among adults from all walks of life. This growing popularity raises important public health questions that we are only now beginning to explore with rigorous scientific study. This shift has created a complex new environment for both consumers and healthcare professionals. With dispensaries becoming a common sight in many communities, people are encountering a wide array of cannabis products, from traditional dried flower to edibles, oils, and vapes. The ease of access means that more individuals are trying marijuana for the first time, or using it more frequently than they might have in the past. As its use becomes more normalized, it is crucial that we, as a society, understand the full spectrum of its effects on the human body, moving beyond anecdotal reports to embrace data-driven insights about its potential health impacts. The reasons people use marijuana are as varied as the products themselves. Some seek its therapeutic properties to manage chronic pain, anxiety, or other medical conditions as prescribed by a physician. Others use it recreationally, much like alcohol, to relax and socialize. This widespread integration into daily life means that millions of Americans are now regularly consuming cannabis without a complete picture of the long-term consequences. As scientists and doctors, our responsibility is to provide clear, fact-based information to help people make informed decisions about their health, especially as we navigate this new era of cannabis accessibility and use. The increasing prevalence of marijuana use makes understanding its health implications more urgent than ever. For a long time, the focus has been on its psychoactive effects or its potential therapeutic benefits. However, we must also turn our attention to how it interacts with the fundamental systems of the body, such as the cardiovascular system. As more people incorporate cannabis into their routines, the need for comprehensive research grows. It is this scientific exploration that will ultimately provide the answers necessary to guide public health policy and individual choices in a way that prioritizes long-term well-being for everyone. Recently, a major study has brought the relationship between marijuana use and heart health into sharp focus, providing some of the most compelling data we have seen to date. Researchers from a large Harvard-led study analyzed health information from over 430,000 American adults over several years. Their findings, published in the Journal of the American Heart Association, revealed a significant link between using cannabis and experiencing serious cardiovascular events. Specifically, the study showed that people who use marijuana have a higher likelihood of having a heart attack or a stroke compared to those who do not use it at all. What makes this research particularly noteworthy is the clear correlation it found between the frequency of use and the level of risk. The data indicated that the more often a person used cannabis, the higher their risk became. For instance, daily users of marijuana were found to have a 25% greater chance of a heart attack and a striking 42% greater chance of a stroke when compared to non-users. This dose-dependent relationship suggests that the cumulative exposure to cannabis could play a direct role in elevating cardiovascular risk, a finding that challenges previous assumptions about its relative safety. The study's findings weren't just limited to heavy users. Even people who used marijuana only occasionally were found to have an elevated risk. The research showed that weekly users had a 3% higher likelihood of a heart attack and a 5% higher likelihood of a stroke. While these percentages may seem small, they are statistically significant and important on a population level, given the millions of Americans who now use cannabis. This suggests that there may not be a completely safe level of consumption when it comes to cardiovascular health. Crucial piece of information for anyone who uses marijuana, no matter how infrequently. To ensure their findings were robust, the researchers were careful to account for other factors that could influence heart health. They adjusted their analysis to control for things like age, tobacco smoking, body mass index, diabetes, and even physical activity level. After all these adjustments, the link between marijuana use and heart attack and stroke remains strong. This This strengthens the conclusion that cannabis use itself is an independent risk factor for cardiovascular disease. It is important to note that this is an observational study, showing a strong association rather than proving direct causation, but the connection it highlights is too significant to ignore. When we talk about marijuana use, it is essential to consider how it is being consumed, as the method can have very different implications for health. In the recent large-scale study, about 3/4 of the cannabis users reported that their primary method of consumption was smoking. This is a critical detail because the act of burning any plant material, whether it is tobacco or cannabis, creates and releases a complex mixture of toxins and particulate matter. When these substances are inhaled, they enter the bloodstream directly through the lungs and can have immediate and long-term effects on the entire cardiovascular system. The smoke from burning cannabis contains many of the same harmful components found in tobacco smoke, a substance we know is a major cause of heart disease and cancer. These toxins can cause inflammation in the blood vessels, make the blood more likely to clot, and contribute to the buildup of plaque in the arteries, a condition known as atherosclerosis. Over time, these effects can stiffen the arteries and reduce blood flow, increasing the strain on the heart and raising the risk of a heart attack or stroke. The fact that smoking is the most popular method of marijuana use is therefore a major public health concern. While the recent study did not specifically separate the risks associated with different consumption methods, such as smoking versus edibles or vaping, the known science behind inhaling smoke provides a strong clue. The biological mechanisms are still being fully explored, but we know that our bodies have a system of receptors called endocannabinoid receptors that interact with THC, the main psychoactive compound in marijuana. These receptors are found throughout the body, including in the heart and blood vessels. It is plausible that the interaction of THC with these receptors, combined with the toxins from smoke, contributes to the increased cardiovascular risks observed. This information is vital for people who use marijuana, as they may not be aware that the method of consumption could be just as important as the substance itself. Many may believe that because cannabis is a plant, smoking it is somehow more natural or safer than smoking tobacco. However, the science of combustion tells us that this is a dangerous misconception. The act of inhaling smoke, regardless of its source, exposes the cardiovascular system to significant stress. As we continue to research this topic, understanding the distinct risks of smoking, vaping, and edibles will be a key priority for protecting public health. In light of this emerging evidence, the medical community is beginning to adapt its approach to patient care. For years, doctors have routinely asked patients about their diet, exercise habits, and whether they smoke tobacco or drink alcohol. These questions are fundamental to assessing a person's overall health and identifying potential risks for chronic diseases like heart disease. Now, based on the strong association found in recent studies, there is a growing consensus that questions about marijuana use should become a standard part of that conversation. This is not about judgment, but about gathering a complete picture of a patient's lifestyle. Asking about cannabis use allows doctors to provide more personalized and effective care. If a patient reports using marijuana, especially if they smoke it, a physician can better evaluate their overall cardiovascular risk profile. This knowledge might lead to more vigilant monitoring of blood pressure and cholesterol, or it could prompt a discussion about the potential dangers and harm reduction strategies. For example, a doctor might explain the risks associated with smoking and discuss alternative methods of consumption, or simply encourage moderation. Open and honest communication is the first step toward empowering patients with the information they need to protect their heart health. The goal of this new line of questioning is proactive preventive medicine. By identifying marijuana use as a potential risk factor, healthcare providers can intervene earlier to help patients mitigate that risk. It puts cannabis use in the same category as other well-established lifestyle factors that influence long-term health. For patients, it is crucial to be forthcoming about their habits. Your doctor is a confidential partner in your health journey, and withholding information about marijuana use could prevent them from seeing a critical piece of your health puzzle, potentially delaying important preventive advice or care. Ultimately, being aware of the potential risks associated with marijuana is about making informed choices. As cannabis becomes more integrated into our society, It is our collective responsibility to ensure that its use is guided by scientific evidence, not just social trends. The recent research serves as a powerful reminder that natural does not always mean harmless. By fostering open dialogue between patients and doctors and continuing to support rigorous scientific inquiry, we can navigate this new landscape responsibly and work toward a future where everyone has the knowledge to make the best decisions for their long-term health and well-being.